Pharmacy is more than just counting pills. It's about building trust, creating change, and being the bridge between the medicine and the people who need it most. Hi, my name is Janai Elder, and I will be attending Howard University School of Pharmacy this fall, starting as a P1 to start my education to work towards becoming a doctor of pharmacy. And I'm very, very excited. And today I'll be applying for the United Health Foundation Healthcare Scholarship. The prompt goes, what core principles or values do you believe are most essential to creating positive change in your community and future career field? How do you plan to embody them in both your educational pursuits and interactions with others? So I have 4 core principles that I'd like to focus on today, which are compassion, integrity, lifelong learning, and service. I chose pharmacy for the compassion aspect. That was definitely one of the driving factors in wanting to become a pharmacist. I'm currently working in the retail setting, and being able to see the patients and listen to them and hear about their families, hear what's going on multiple days a week or even multiple months in a row is rewarding to me. I'm getting to see them, maintain their disease states, get better. I'm just hearing about their lives, creating that relationship with the patient. Patient relationships are very important when it comes to adherence to care. And I feel like having that good patient relationship and having clarity, because healthcare can be very overwhelming, is what's helping that. Then, next up, I have integrity. Integrity is essential. Pharmacists are among the most trusted healthcare providers, as we do see the patients a lot more often than doctors, nurses, or dentists. You're more likely to see your pharmacist than any other healthcare provider, what I read in a study. So I think that maintaining that integrity, maintaining that standard in my schoolwork, in my current job, working in a lab, just always paying attention to detail. If it's not right, you need to say something. I'd rather say something than hurt the patient or something else go wrong. Just having that standard. I want to begin my career focused on growth and innovating, going to the next level, building myself up. Then I have lifelong learning. I think that pharmacy is a very versatile field. There's so many different avenues you can go down. And for me specifically, I would like to work in regulatory affairs. So I feel like having that mindset that medicine is always evolving, medicine is always changing, and really wanting to grow with it and not only educate myself, but educate my patients and my colleagues is something that's very, very important. And lastly, we have service. Service not only for myself, but like service for the community. I want to get rid of these healthcare disparities. I want to have access to care. I will be that pharmacist that's running a clinic. I will be that pharmacist that's down, getting dirty, doing all types of things just so I can make sure that my patients feel taken care of in the community. And through my education and every interaction, I strive to live by these values. My goal is to empower the patients, uplift myself, and continue to learn so I can help them. I hope that I was able to convey to you today as to why I would very much appreciate this scholarship. I'm very excited to start school. I'm compassionate about my field, and thank you for listening. And I hope you consider my application.